Tennessee Death Row Dogs, your local dog rescue nonprofit. Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome to Nashville's Best, where we showcase the very best in Nashville local business. We're here with Dr. Kent White from the Center of Advanced Dentistry. Welcome, mate. Thanks for coming in.
Good to see you, Kane. Thanks for having me.
Mate, I know you guys do some amazing things and a whole range of different systems that you use. Let's talk a little bit about those first and foremost.
Okay. I'd say about four primary areas that we do. One is traditional dentistry. We have basically people come in, they get their teeth cleaned, the normal hygiene visit, kind of the 6-month jingle that a lot of us have been taught. And a lot of that, in my opinion, over the last 20 years is just get, especially us guys, just get us used to coming in, keeping everything clean. But the biggest thing over the last 15 years I've focused on is a branch of dentistry called biological, biomimetic, alternative, and just think of it like mimicking life. If you think back to high school, we took biology. Some did better than others. And so biology was life. So since we've been made with the hardest structure in our mouth is teeth, one of the things that I started noticing over the years is we were putting metal in, we were putting mercury in, we were grinding teeth down and putting caps on the teeth that really didn't look like teeth.
Foreign objects, I guess.
Yeah, they really are. Or we couldn't x-ray through them, or we were just grinding unnecessary tooth away. So again, literally 20 years ago, after I started in my residency programs, we started basically exploring different methods, different ways to treat teeth. And, you know, I don't know, about 80% of my practice, or 70%, let me edit that, about 60% of our practice are people aged 60 to 100, 102, most still with their teeth.
Wow.
So that means we need to change, or I believe we need to change, the way we're restoring or fixing or rehabbing tooth or teeth, so 20, 40, 60 years from now, depending on your age, you know, you'll have tooth left. So the biological alternative dentistry just allows us to place materials that mimic more what the tooth does, what it is, the living part, the outer part. We might use a veneer, we might use an inlay, we might use an onlay. But I think the most important is finding the type of specialty dentist that does this exclusively. And it's associated with certain programs that teach and do this kind of dentistry.
Now, I know, you know, the word bio, when anyone hears that, it gets thrown around so much nowadays in foods and all those different things that can kind of sometimes mean exactly what you're not trying to get across, and that is manipulating the situation to be something that it's not.
Right.
But you guys essentially try and get the tooth back to being in its normal state, I guess, more than anything, as much as you possibly can.
You know, and we always say, it's kind of like the word cosmetic. I have a little cliche I use. I want to restore my tooth or teeth back to the original health, strength, and beauty in the most conservative manner possible. And it's kind of like tooth banking. I want to save as much as I can and restore it, because every time we drill on it, and I know a lot of the general dentists hate when I say this, but we weaken a tooth every time we drill on it.
I'm certain that there's a lot of people out there that would not like their you know, stay away from that drill.
Hey, I was hurt as a child, or wasn't allowed to be numb long enough. I'd get a shot, and then shots did not hurt me as much, but they would start drilling before I was numb. So this started at an early age, and you know, I did not realize until the last few years that I had been traumatized, kind of an emotional scarring and a physical scarring. And I remember going to a pediatric person. You know, these were years ago. And so going to the dentist was not something I ever looked forward to. So I had a mission. I still have a mission every day, and we call all of ourselves a student for life, and I certainly am one. But I have an obligation, I think, to this field to do some of the things different than what we've done in dentistry in the past. The fact that periodontal disease, which is still our biggest tooth loss problem that we have in dentistry, the periodontal disease, as boring as all this may sound to a lot of people, we have multiple people literally daily losing tooth or teeth from this disease of the mouth. And you may hear it called pyorrhea, burning mouth. I hear a lot in our office called gum disease. I kind of cringe every time I hear that, because gum just basically is a matting to the bone, much like a matting around a print is a matting to that framed print. So it's really bone disease. In other words, it's bone that's holding the teeth in, and there's not a day that does not go by that I don't see a tooth that's split from a big metal wedge tooth splitting device that we call mercury fillings, or that disease I just talked to you about, the periodontal disease. And they're all kind of silent killers of the mouth. Silent to me basically means I don't know they're there. I'm not hurting, I'm not having symptoms, and unless someone really does a thorough video exam or a camera exam and x-rays and saliva tests and things like that, you may never know you have it.
Well, I mean, I know you say that it may be boring to everyone out there at home, but I bet you there are a lot of people who are sitting around saying that very thing. I mean, I think we grow up thinking that we lose our first set of teeth, which we kind of get used to, and then we have this next set of teeth, which we're told to look after, but we get to a certain age where we think, oh, well, I've had that filling or a little discoloration, or I've got a sore, or one falls out. You kind of think, well, that's just a natural progression, but it does not have to be that way. And I think that, dentistry is so far advanced to where it was when we were kids and, heard that drill and everything hurt, and to sort of remove that myth and say, especially blokes like us, say, it's like getting into your doctor. Every 6 months, go into the dentist and get your teeth checked. Right,
and that is the basics. That's the basics, at least to get you developing a habit. I don't know how long it takes to actually develop a habit, excuse me, but one of the things, if you start every 6 months and we find that you do have periodontal disease, or we find that you have what we call TMJ or neuromuscular issues, which is kind of our third focus. We've kind of talked about biological-based dentistry or alternative dentistry, holistic dentistry. We talked a little bit about the periodontal or the bone issue. The third issue that I really like to focus on is the neuromuscular or the TMJ. And we have a lot of pain patients that may or may not be aware that their neck, their migraines, some of the other issues are related to the way that the jaws come together.
Right.
And one of my buddies in San Diego says, it takes a lot of muscles to keep this 8-pound bowling ball. My wife says it might be a little heavier, but it takes a lot of muscles to keep this up, and we only have really one moving part other than eyelids, and that's our lower jaw. That being said, so during these 6-month exams, whether I'm doing an oral cancer exam, a cleaning, a video exam where patients can see everything that we're seeing, which I think is the standard of care, or should be in 2014 for sure. There's just so many things we can find, or at least have the person look and decide on how important that is to them. Because, we're to the point to where, one of my mentors says, education does not work. I cringe every time I hear it. But what he's basically saying is education doesn't work until the person's ready to hear it.
It's true.
So if I have someone that I care about, physician, dentist, chiropractor, therapist, and they're kind and they're gentle with me until I'm ready to quit or change whatever habit that is, when I'm ready, that is the person I will go back to. So often that 6 months for us is just fostering rapport and hopefully even relationship, because our guests are very important to us.
Well, I mean, I know as someone who probably doesn't go to the dentist as often as I should, but at the end of the day, I mean, you're very vulnerable, laying back there with the mouth wide open, probably getting told to open it even wider while someone sticks a bunch of foreign objects in there and fingers. So the rapport that you build with your clientele is extremely important.
Yeah, it is.
And that trust, I imagine, as well.
I think the trust is first and foremost. I mean, we do a lot of different options for people to come in. When I'm working with like dental phobics or people that may have been emotionally or physically wounded in and around the dental office, we may have those people just come in and just hang out and visit with us. Believe it or not, people take us up on that.
Yeah.
In other words, it's a no-charge thing. We do 2 or 3 things no charge because we want it to be a good fit both ways. And so it's kind of an interview process. So somebody will come in, look at our sterilization area, look at where we do our photography and video areas for the teeth, and look at our digital radiograph machines that allow us to display radiographs in 2 or 3 seconds. We have another group that's interesting that have gone to their general dentist, and they want I consider ourselves super generalist. They want a second opinion and more of an alternative route. So we'll do exams or, short complimentary consultations so they can say, oh, this is another kind of dentistry. There are only 2 or 3 possible answers. I don't like this. I do like this. Most say I had no idea these kind of academic and technological advances were out there. It only takes a credit card to be technologically advanced. It takes many years to be academically advanced, and that is our focus.
Yeah.
I mean, technology's great. I've had lasers and digital this and that since 1994, and can't imagine not using those daily.
Sure.
But to me, first and foremost, is that academic, and in turn, we're always treating a person, we're not treating teeth. Never had a tooth walking by itself.
That's fair to say. Mate, we've absolutely loved having you on the show, and you are going to be a part of Talkopolis family, which we're very proud of as well moving forward. Just let the folks know at home where we can find you, and down the camera and away you go.
All right. Well, I'm on 21st Avenue. I'm at 2300 21st Avenue South. We're at Suite 103. We're about a mile off of 440 as you go down toward Green Hills or Belmont, Vanderbilt area. Our website is whitesmilesforlife.com. It's www.whitesmilesforlife.com, and it's been great.
It has, and we're going to put all that information for you guys up so that you can find Dr. Kent White and his fabulous team. He's got a group of people there. It's very much a family clinic, and I'm certain if you guys get down there with this influx of people into Nashville now, this is the dentist that you want to spend your time with, mate. Thank you again so much for being with us.
All right, man.
And we will see you again on Nashville's Best.